second hour of Nightline. And we need to just get back into it because this first hour flew by, Dr. Ghen. But if you're just tuning in, we've got Dr. Mitch Ghen all the way from Florida. It's excellent. Just had a grandbaby today.
Yes.
And you chose to still be with us. You must really love us.
I do. I miss, of course, I miss your parents dearly, but being with you is just amazing. It's just like being with Joanne and Jimmy, and also the fact being here back. This is home for me. We did these shows before. We used to love doing them twice a month, and it's great being back and talking to the people of our our community.
And
so
they're wonderful. And we want to encourage you to continue calling in. But before the break, we had Billie Jean and wondering about bladder infections.
Yeah, she was wondering why is it that she didn't say women, but I think she meant women, get bladder infections so much. And Billie Jean, the reason that occurs is several. First, you have to realize the anatomy of the female. There are actually three areas, three holes in the female anatomy that are very close to each other. You have the urethra, where, of course, the urine goes, and that's what's supposed to be sterile. Then the vagina, and then the rectum. So none of those areas are supposed to mix the secretions. So it is possible to, if you wipe the wrong way or any type of activity, even sexual, that mixes those fluids will cause an ongoing bladder infection. And if you don't treat that bladder infection long enough, which is often the case, these colonies that are left behind multiply very quickly. So some of the general things are always remember with toileting to always wipe from front to rear. Make sure you drink plenty of fluid and wash the bladder out well. Don't sit in a wet bathing suit too long. Careful with the hot tub thing because you never know what's in a hot tub, of course. You don't want to get infections that way. And, of course, once in a while you have to take extra things like vitamin C in large doses. And actually, they have found this cranberry juice thing we've talked about so many times. It does work in large enough doses to stop the most common of the bacteria, which is E. coli, from adhering to the bladder wall. So drinking a lot of cranberry juice, of course, be careful. The typical cranberry juice is loaded with sugar. We're talking about real cranberry juice, which is a little bit tart. And that can help. And there are other things like something called D-mannose, that's D-MANNOSE, which also does the same thing. It stops the E. coli, the most common bacteria, from adhering to the bladder wall. So if it continues, there are several other things that you could do, but most of the time when someone has recurrent bladder infections, it's because either they are bringing that bacteria into the urethra and back into the bladder, or they never killed the entire colonies that were there to begin with. Either one of those. I hope, Billie Jean, that answers your question and gives you some ideas on which way to go. And, of course, call us back if that didn't handle exactly what you were thinking. Thanks for calling, by the way.
Well, I'm going to do a couple of here because they're all pertaining to vitamins.
Okay.
People calling in. I'm having hormone problems causing me to gain weight. How can I battle this? Maybe with vitamins. That's number one. Had vitamin D checked. Level was 17. How does she get the level up? Hang on, bear with me. How do you know what vitamins are right for you? Not you, but the caller.
Yeah.
So, and here's a lady, had a heart attack 2 weeks ago and has been taking B12 shots. Wanted to know what he can do to replace the B12 shots.
Wow. Okay, so we have several things. I'll try to remember all these for you.
I can read them.
But I mean, the first thing with the woman saying that she's having difficulty losing weight and which vitamins to take, there's always a certain vitamin standard that everyone should be taking. And that is a good multiple vitamins, which we're going to talk about later, but a good multiple vitamin, vitamin D3, which I'm going to talk about in a minute because of the caller. And then, of course, to take some essential fatty acid, and depending on age, coenzyme Q10, and a probiotic. Those 5 things are the basis. Now, if you don't remember them and you want to know which ones are good ones and how to do it, I always tell people you can write me. I answer every one of my own emails. One of my email addresses is no, that's not it. It's drmitch@drmitchshow.com. I think you'll see the address on the screen now. It's www.drmitchshow.com.
Is that right?
Or you can also write me at that other email address, and I'll be glad to send you the information that you're looking for. And you can always check the website, which is drmitch at drmitchshow.com. It's right there on the screen too. And that always has the things that you're looking for. You could check that out. We can talk about that later. Now, as far as the vitamin D3, one of the most important vitamins in the world right now that we found is no longer considered a vitamin, but it is a hormone. And levels normally in labs say they're supposed to be between 30 and 100. Yours is 17. Now, between 30 and 100, those numbers are becoming archaic. We realize by many studies that the people that are the healthiest are between 60 and 100. As a matter of fact, so much so that there's a reduction in cancer rates, heart disease, etc. So if yours is 17, to give you an idea, it takes anywhere from 5,000 to 8,000 units just to maintain a level, and it takes between 10 and 20,000 units to climb a level. And by the way, it's not going to happen very fast. It's going to take time to get that level to climb up, maybe 6, 8 weeks. Talk to your physician and see if they're okay with that. Many physicians are not cleared nor understand how vitamin D3 works, but 17 is way too low. And don't feel bad. It's typical of most people in the United States. I actually looked at one time 2,800 people in Florida where people were always getting sun and their levels were very low. And then I looked at the Hawaiian studies, which also have perfect weather, and it too was very low. There's many reasons for that we could talk about. So start taking a dose. Ask your physician if you could take a dose of somewhere between 10 and 20,000 units a day. Check it in 6 to 8 weeks. You'll see it still won't get up to 60 to 80, but it should bring you in at least into 40 or 50 area. I hope that answers the question. Now, for the B12 that you're taking shots right after your heart attack, I'm not sure why you're taking B12 after the shots. I assume maybe that your homocysteine level's elevated. Because I don't have the capability of knowing that, you can use B12 sublingually under the tongue. If you check out the drmitchshow.com site, you'll find something on there called methylcobalamin. That is the Cadillac of the B12s. It's methylcobalamin. I'm not a good speller. Sorry about that. Methylcobalamin.
They can find it on your website.
You can find it on the website. And B12 sublingually has been shown in many studies to be as good as the injection. So that's an easy problem to solve. You don't have to keep giving yourselves injection. And by the way, if you're using the cheaper version of the injection, which is cyanocobalamin, look at your bottle and take a look. Cyanocobalamin has a cyanide molecule in it. And we don't want you taking that. I mean, you really don't want to take that. Nutritionists and experts in integrative medicine would really shy away from that. Check out the methylcobalamin. It comes as 5 milligrams. That's 5,000 micrograms. Using it under your tongue every day, it will do the same job as if you're taking the shots. I hope that helped. Did I answer?
And how do we know what vitamins are right for us?
Oh, yes. How do we know what vitamins are right for us? The answer to that is we don't. And we're all different. And that's why I'm pretty much not into the multi-level marketing concept. I mean, it's better to take something than nothing. But I do I always tell people, take the 5 things that we just talked about. But I always say, look, if you get your blood work and you can look at the blood work, your chemistries, that which makes you up. We are so complex. We're 868 trillion chemical reactions per second. I mean, put all the computers together, no way they could do what God's made us, our bodies can do. So go ahead and get some chemistries done, get a good nutritionist, get someone to help you, and you could even upload your vitamin, your blood tests to my website or to my thing. I also like Dr. Mitch at drmitchshow.com. That's an email. We look at it all the time, and I answer all of them. It's Dr. DRMITCH at drmitchshow.com, drmitchshow.com. And I'll say that a couple more times. And if you send me, upload it, I can give you information. Like we said in the beginning of the show, and Danté, you've said so perfectly, we can only give information. We're not here to create any doctor-physician patient relationship. We're here basically to give you great information. And that's what we did when we did Health Options. That's what it was called, Health Options today. Yeah, we were meant to remember. It was great.
Excellent. Well, we got a caller, but real quick, I want to mention this real quick. It says the show has, this lady called in, show has moved me to improve my health and to lose weight.
Wow.
said that there's been a really huge blessing, and they had all but given up. So we've encouraged them. Says thanks to Dr. Ghen and TV16 for the encouragement.
Well, I have to tell you, that's the best. That's the best.
Wonderful.
You know what? If you can influence one person in this world in a positive way, if we all did that, I mean, collectively, wouldn't this be an amazing?
It changed
amazing,
overnight.
Yeah, we changed the world.
Yeah. But we got Lynn on the phone. Lynn, go ahead.
Hi, Lynn.
Hello?
Hi, how are you?
Well,
Oh, is this Ann?
yes.
Oh, I'm sorry,
I have
Ann.
a weight problem. I'm 68, and I've always had a weight problem. And it's just got to where I just don't care, and I eat a lot of sugar, and I do take some vitamins and stuff, but I have knee problems, and I'd like for you to give me a word that would help me get motivated to follow your advice. I'm very excited to hear you tonight. It's God's sent that I turned you on tonight, and I was wanting your help.
Well, Ann, I am so glad you called. And Ann, I know that I heard what you said. And you said, I just don't care anymore. And Ann, you have to care. You have to care about yourself. I don't know you, and one of these days, hopefully, we'll do a show where I can talk a little bit longer to the individuals. But you know, it's not just about you. It's about your family. It's about other people that care for you. It's about those that depend on you. And even if there are none, you depend upon yourself. The key is getting quality of life, Ann, to go back to quality. And by the way, it's never too late. You could be 89 years old. You could be overweight. You could have what you would call poor health. It is never, never too late, Ann. First, you have to realize from a spiritual perspective, we're looking at, we're all God's children. God wants us to have the best life we've ever had in this time. Right. We get such a short time, right, Dante? We don't have enough time. So it's so important for the Anns that are listening. It sounds like a wonderful woman to just begin with a simple step. Maybe tomorrow, a slight change. No more candy, no more cakes, no more pastries. Just try that, Ann. No more cake, no more pastries, no more candy. And just a little bit of exercise, maybe a walk, something. Start with that, and then let's take it from there. Let's start a little bit, Ann, please.
Excellent. Well, here's a grandchild, has severe eczema. Is there any treatment, natural or vitamin to help?
Great question. Eczema is a major problem that's out there right now. More and more kids are getting it. The very first thing you want to do with a grandchild with eczema are in two categories. One, eliminate foods that could be creating eczema. Eliminate the wheat, the rye, the barley, the oats, the gluten foods. I'll repeat them. Wheat, rye, barley, oats. Get rid of them.
And there is gluten-free breads and even pizza crusts and everything out now. So.
Absolutely. So let's get rid of them. Let's get rid of all the wheat in the diet. Let's get rid of all the corn in the grandchild's diet as well. That's important also. Get the grandchild. It's a shame I don't know how old the child is, but there are essential fatty acids, and the essential fatty acid that's in the skin is not the omega-3. It's not the fish oils. I know everyone thinks that. There's no fish oil in the skin, folks. It's the omega-6. So get a good organic, I don't mean the omega-6 like the stuff you cook with in the store. Get a good organic omega-6. Depending on the child's age will depend upon the dose, and you want to use a little bit larger than normal dose. And simultaneously, take that child, put that child out in the sun, make sure the child's getting vitamin D3. That was perfect, by the way, what you said. And get that child to the ocean. That's right. Even though we may live a little bit inland up here, get that child to the ocean, get the salt water on the child, get the vitamin D from the sunshine, eliminate the wheat, gluten, rye foods, barley, get some more of vitamin D3, and of course, increase the essential fatty acids. And on the skin, you can use something very simple like an organic coconut oil. You can find that anywhere. It's very nice. You can put it on. It's delightful. And hopefully, this combination will begin to aid this child in recovery. I hope that gives you some of the answers, and we could talk about eczema again in the future.
Excellent. And I've heard coconut oil is good to cook with for Alzheimer's patients.
It is an amazing oil. You know, everyone's always afraid of a saturated fat, but coconut oil, the energy, because it's what we call a medium chain triglyceride, it's used by the body very quickly. And once it's utilized by the body, you can take more of it. And if you take a couple tablespoons a couple times a day, it actually helps the brain. What is the brain? It's first water, and the next biggest item happens to be fat. So if you replace the good fats, take away the fats that are oxidizing or rusting, then we see these patients getting, and there are websites that show 150 ways to use coconut oil.
Wow.
It's an amazing, amazing item.
That's
to use.
awesome. That's awesome. Here's two real quick on hormones. So we just touched on that briefly.
Sure.
If your testosterone is low, can you do something about it? Here's a 63-year-old man with a level of 103. And then a lady wants to know if women in their 80s should take hormones if they have.
Wow, what great questions they are. Well, first to the male, 63. You should be able to be healthy and active into much older. I mean, there's no reason why a male or female can't stay sexually active well into their 80s, 90s. There's no reason for that. And if your testosterone, which is very low, by the way, 103, you can ask your PCP or another physician to replete you by making a bioidentical natural type of hormone replacement. That is using a compounding pharmacy like our friend Buster at Congaree Pharmacy to make a testosterone that is compounded from either yam or soy. And that can be done as a cream. There are natural pellets that can go right under the skin, but you can get the testosterone back. And make sure the doctor that does that knows how to make sure the metabolites are shunted into healthy pathways. So just make sure someone who knows how to do it properly. But no reason at 61 you should not have a vibrant testosterone level. And for the lovely woman is 80 years old asking about hormones, we have to go back. Most people would say, you know what, at 80, what do you need hormones for? Well, if you think sexually, it may not be important. But you have to realize, what does a hormone do? It allows one cell to talk to the other. It's our communication system. When we were our healthiest, for those that listened in the first hour, or when we were high school kids, when the hormones were raging and they were high. So get someone who can test your levels, make sure that you have your, you've had all your things checked, whether it's mammography, thermography, whatever it is you're doing, MRI. And once you've been checked out gynecologically, why not consider some hormone replacement, but very lightly, very gently. You won't get back to where you were at 35, but even if it helps improve the cellular communication that makes you feel 10 or 15 years younger, wouldn't that be great? So get it checked out. Gently, slowly, someone that knows how to do it very easily.
Excellent, excellent. And testosterone is more than just sexual. It helps with your attitude, your mood.
Absolutely.
It's more than just that.
Oh, yes. When women start to have that cognition delay, they're not thinking as clearly as they used to, testosterone often part of it. Our heart health, male and female, often related to testosterone. Bone health, even now, many articles showing related to our testosterone levels as well. And the whole thing about testosterone is that hormone is the hormone both for male and female that gives us that joie de vivre, that enjoyment, that focus of life. And if you start to lose that, and I often tell men, you remember when you were younger, you couldn't wait to get up, go to work, you were ready to go, you were excited about what you were doing. Now it's, if I go, I don't go. Often that is a very first sign of testosterone breaking off. In females, similarly, but often it's that I'm not thinking as clearly and I don't feel like going to the gym as much. Testosterone is probably breaking off. Get it checked. It's a simple blood test or a simple saliva test. You'll get the answers that you're looking for.
Excellent. I think we got a caller.
Teresa from Duncan. Hi, Teresa. Welcome to the Dr. Mitt Show.
Go ahead, Teresa.
Yes, doctor. I have an ileostomy, and I have to wear a pouch. And every now and then, it will turn blue or purple if I wear it like for 3 or 4 days, and then it will try to go back.
Go ahead.
And it will try to turn itself back to the regular color. I wonder what causes that by turning blue or purple.
Well, it may be secondary to some of the foods you're eating or some of the nutrients that you're taking. May be changing the color. It's also, the color may change if it's not working or moving out smoothly, or if it's not, you don't have enough water. So make sure you change the bag as often as you are prescribed to do, and look at the foods that you're eating in relationship to the color that you may be seeing in that bag at the end of that day. Often it's related to some of the foodstuffs and perhaps some of the preservatives and things that are in the food. You might want to change your diet a little bit to become a little bit more green, have a lot of green drinks, raw drinks, so to speak, healthy organic drinks, and that may keep that color just the same color all the time. I hope that helps you, sweetie. Thank you for calling.
Excellent, excellent. Real quick, a couple about bones, all right? A lady, has 3 questions here. A lady wants to know if she should go to a chiropractor for a ruptured disc. Could surgery on a back cause someone to not be able to walk good? And then, how long does it take for a broken hip to heal? This lady is 92, broke her hip March 23rd, and she's in therapy.
Wow. Okay, so we're talking about a chiropractic physician. Chiropractic physicians are part of our healthcare community, and for a herniated disc, often they have techniques for creating less problems and be able to traction and allow release of that herniated disc. Now, sometimes if that disc is totally herniated and there's a fragment that's inside, it may only be helped by doing some sort of surgical procedure. So there is nothing wrong with starting to see your chiropractic physician. Go to one who's excellent at reading x-rays, that can go over your case with you, do a good neurologic examination, and he or she might be able to give you some relief. They are part of the care team when it comes to a bad back. And can surgery make a bad back worse? Listen, there isn't always or never, should never, okay, ever come into our vocabulary. There is nothing that's perfect. There are studies that show that certain back surgeries, a Canadian study years ago, that most people that have back surgery shouldn't have had it. And if you get scar tissue, you may not do as well. The minute you touch a disc or even put a needle into it, it's been shown that it then has lost its hydration and it becomes weaker. Now, surgery should always be a last resort, a resort for when other modalities and other things are not working. And we don't, as I said, we never throw surgery out, but can it make things worse? Unfortunately, yes. Anything can make things worse. Manipulation can. Medication, can make you worse. So unfortunately, it can create scar tissue and difficulty as well. And how long is it going to take for your hip to heal? Well, you're 92 years old. God bless you. And, it will take a little longer. But make sure to talk to your doctor about taking lots of magnesium, lots of calcium. Make sure that you take a good anti-inflammatory. I love the natural Super Bio Curcumin. That's Super Bio, B-I-O, Curcumin, C-U-R-M-I-N. And you can check that out on the website. It's drmitchshow.com, drmitchshow.com. Talk to your doctor. It will take a little longer when you're at your age, but if you put all the building blocks, the materials, you're going to find you're going to heal quickly.
Excellent.
Hope that helps.
Yeah, and 92 years old, how long should her hip?
Well, I think we're looking at probably, if they got her up 5 to 8 weeks, then she should be up and running.
Excellent.
Yeah,
excellent.
I think she'll be fine.
Sounds good. We got another caller, Tyler from Greer. You're on with Dr. Mitch.
Hi, Tyler.
Hey, I had a question about gout.
We've had a lot of calls about gout.
Okay.
What could you do for it?
Yeah, that's a great question, Tyler. That's a common disorder from the way we're eating. For those that don't know, gout is a disease of a enzyme that's partially missing called HPRTAs, and it's a hereditary problem. And of course, these crystals of uric acid can get stuck in a joint. Typically, it's to the big toe, but it can happen in any joint. It can happen in the wrist, it can happen in the knee, etc. But what you could do with it, first of all, is make sure that you're drinking plenty of water to flush the system out, and stay away from alcohol and very rich foods like gravies and things of this nature, especially organ meats. they're really a problem when it comes to gout. And if you want to try 2 remedies, so I know if you're calling Tyler, there's 1,000 others that are listening to the show about gout, right?
Yeah, we've had several calls.
Of course.
Yeah.
So I'm going to give you 2 good things you could try. They're natural and they do a great job. Get an organic apple and eat 1 organic apple twice a day. That's going to help. And you could take black cherry juice and drink that too twice a day. So black cherry juice and or a good organic apple twice a day, lots of fluid, stay away from those foods, and most of the time you can have your gout start to back off. Check your uric acid with your doctor and you could see if that level is coming down. And if that doesn't work, we have other tricks too in the future for you.
Excellent. And black cherry juice, that sounds awesome.
Yeah, it actually tastes good.
So I like.
it's good.
I've been drinking a lot of acai juice lately.
Oh, you're into
really
acai?
like that.
Okay,
Yeah.
good.
Oh, that's
Good
pretty
antioxidant.
Stuff. It's
Yeah.
excellent. Here's a couple of ladies. One is the side effects of Coumadin, and here's another one who has nerves in her legs. And her legs gives way, and she's on Coumadin, can't eat greens. Wondering if Coumadin might be causing that problem.
Well, here's the issue with Coumadin. If we look at medicines, all medications can reduce the nutrition in our body. They actually rob the body of different vitamins and minerals. I often will ask a group of physicians, tell me the particular medication that robs the body the most. And they'll say birth control pill, they'll say water pills. They're all right. But there are 2 medicines that do the most damage when it comes to nutrition. One happens to be corticosteroids, cortisone, and the other happens to be Coumadin. Coumadin is an anticoagulant, keeps the blood thin. And unfortunately, simultaneously, it robs the body of so many vitamins and minerals. And of course, everyone's afraid to eat greens because they feel that the grains will upset the Coumadin and you'll have to take more of it. And it's true, and on the other hand, it's not necessarily true. You do need your greens. You do need to have some vitamin K in your system because it also protects the bones. Everyone thinks you don't need to have it. So that's the problem. So people that are on Coumadin need more vitamins and minerals than the average individual. It goes back to how do we individualize this? Again, we look at someone's history and their physical. And in this case, when we see medications that are robbing the body constantly of these nutrients, we have to give more than usual. So instead, for example, like the multiple I use often, I give, which is called the Dr. Mitch's multiple, just the name of it. I'll give, usually it's 1 twice a day. For someone on Coumadin, I'll make sure they're taking 2 twice a day. And then they can monitor their Coumadin levels, etc., to make sure they're healthy. But that's the reason they're having this problem. Can it cause problems in the legs? Of course. If it's robbing the bodies of certain nutrients, yes, it can. You could also have a neuropathy that's occurring maybe from a nutrient loss plus all the other things we talked about earlier.
When my father was on Coumadin, he would get a lot of blood in his urine, urinary tract infections, then they take him off of it and put him back on it, and I don't know.
Oh, you have to be real careful. Coumadin isn't in the right mind. You can imagine the slightest bang of the head. Unfortunately, I've had 2 cases that have had a hemorrhagic stroke, literally bled in their brain because of the Coumadin. It's like anything else. Use it when you're supposed to use it. Get off of it as soon as you can. Often physicians keep people on Coumadin as long because they're afraid to take them off because of why they put them on. For risk of stroke. But there are natural things that can be done as well, and you have to have a discussion, get a good integrative doctor to work with, the doctor or the neurologist that put it on to begin with.
Excellent. Well, we got a caller, but after this caller, let's talk about stroke for a few minutes after this call. So who we got coming up?
Patsy from Greenville. Hi, Patsy.
Hi.
Hey, how are you?
All right.
How can we help you tonight? Patsy, you're live. Go ahead. You can ask your question.
I think we
We might have lost Patsy.
Okay.
Call back, Patsy, if you can.
Well, let's talk about stroke for a minute.
All right, sure.
Reasons, preventative reasons, measures.
Well, we have
all the. Let's talk about it all.
Let's talk it all about. First of all, we have to separate stroke into two broad categories. The number one, 80% of the time, it's an embolic phenomena. It's a clot that breaks off. Second is a hemorrhagic. That's bleeding in the brain. Most people will have the first kind. Their blood gets too thick as we get older. We have diabetes. We eat wrong. We have inflammation. The blood's getting thicker. Occasionally, there's a bleed because of high blood pressure or an aneurysm that could break. But for the most part, it's embolic. So you asked a great question, Danté. What can we do right from the get-go that's simple and easy? Well, let's go to a study that was done on 49,000 7-day Adventists at one time. One of the areas of the study showed that those people that drank 5 or more glasses of water compared to those that drank less actually had 50% less stroke and heart attack risk because of the water thinning or keeping the blood thinner. So the first thing you could do that's so easy is to drink 5 glasses of water more a day. The other thing they found, which is a fairly recent study in the past year, the white meat of certain fruits, the white fruits rather, which is pear and apples, have been shown to reduce stroke risk also tremendously. So if you just take those 2 things to start, of course, and that is get rid of the things that are causing inflammation, which are, of course, the fried foods and the fatty foods and the processed foods, add into it pears and apples, and 5 glasses or more of water a day with, of course, the permission of your healthcare provider, you're already reducing your stroke risk. And then one other thing we said earlier, make sure your vitamin D3 levels are in good shape. And if they are, and they're between 60 and 100, that too reduces your risk. And then there are several other layers on top of that. But there's some early tips that you could start tomorrow morning. They're easy.
Excellent. Now, a lot of people use baby aspirin as blood thinner. Do you advocate that?
I'm not a big aspirin taker because if you look at the studies on aspirin, unfortunately, they're not thinning the blood, and there's a benefit versus a risk. You know, taking aspirin increases your risk of a GI bleed and other problems. And some of the studies that I've read, most of them I should say, do not support that they really reduce the risk. But things like doing the drinking of the water, taking vitamin E, magnesium, resveratrol, all these other things have some great effect on reducing the thickness. Because why is it that when you're a teenager, I always go back to that. I always want to know the why. Why is it when we were young, nobody's having a stroke? In high school, did you remember any of the kids having a stroke? No, neither do I. I mean, there's a rare instance, of course, but why is it that we do as we get older? What went wrong? What things are we doing that is making the blood thick or thicker or clotting that it can break off and go somewhere? And that's really what we want to do. And most of it related to inflammation. Almost every disease now, Danté, related to inflammation.
If the doctor has put a patient watching tonight on baby aspirin, is there a certain that they should look for? Is one better than another, or?
I don't think so. I think any of the aspirin is aspirin. And although some are coated, so some have magnesium in them. If you're going to have to take an aspirin, I would always suggest take the one with magnesium, because the damage of an aspirin is mitigated by at least having the magnesium component in it. So get one that's buffered. The buffered ones have the magnesium. That would be the best.
Excellent, excellent.
That's
I think
great.
we got another call.
We do. This is Jim from Greenville. Jim, welcome to the show, and how can we help you tonight?
Thank you. I would like to know if you have a recommendation for psoriasis, and also, what about a diabetic testosterone? How do you go about looking at that for a diabetic, a gentleman with diabetes?
Great question, Jim. We'll start with the psoriasis, then we'll move to the testosterone. Psoriasis is an autoimmune disease. It's the immune system's not recognizing itself. It loses one of the most important functions of recognition of self, and of course, people get the lesions and so forth. Again, here's a perfect example that you should begin thinking gluten-free. Wheat, rye, barley, oats almost instantly. You should also be looking at your vitamin D3 level. You should be looking at your hormones. You should be looking at your omega-6 to 3 ratio. The omega-3 is what's in the skin. That's a great start. And of course, getting sunshine into the ocean, they're going to be invaluable for you to get this better. Now, you touched on another topic, which is really important. Last year, there was 2 studies, or many more, but on 2 sides of the coin. Here's a diabetic. We know now that if you're diabetic, it is highly likely your testosterone will be low. As a matter of fact, it's almost inevitable. But then there's a study that says, Jim, that your low testosterone may be leading to diabetes. Again, remember, we're hundreds of trillions of reactions occurring simultaneously. So what came first, the horse or the cart? I don't know. But you can bring up that testosterone. As a matter of fact, my diabetic patients, I'm very, very strong about bringing their testosterone back to normal because A, they feel better, B, they have less complications of the diabetes, and C, it helps control, as far as I can tell, their blood sugar as well overall with the medications or whatever else you're using naturally. So don't be afraid of getting testosterone put back into your regimen. It's extremely important. There are studies that support that what came first, before or after, really doesn't matter. The point is it's low, and you should have a vibrant testosterone level for all the reasons that Danté and I have been talking about tonight.
Yeah.
Thank you.
Yeah, real quick before we go to Patsy, this is kind of related to what we were just talking about, blood clots. Here's somebody that's on warfarin. Is that pronounced?
Warfarin is Coumadin, same thing.
Okay,
Yeah.
same thing then.
Yes.
Excellent. So glad we got that.
Sure.
But Patsy from Greenville.
Okay, Patsy. Hi, Patsy. How are you?
Hey.
How are you?
I'm anxious about epileptic seizures.
What's that?
Seizures.
Oh, you have seizure disorder. Sure. Tell me about it. What would you like me to tell you?
I want to ask you what grandma seizure is about.
What it's about, a grand mal seizure, sure. Thank you, Patsy. I'll be glad to tell you. There is electrical activity, as you can imagine, that's occurring at the brain. There are billions of interconnections in the brain that are all electrical. And there is obviously a synchronicity to them. And that helps you to see, to talk, to hear, to think. Well, once in a while, that synchronicity, the charge goes haywire. And when that occurs, we have what's called a seizure. And that seizure actually has many different ways of presenting itself. Sometimes it's an absent seizure where the person just basically fades out and then will come back in. There's seizures which are just on one side of the body that may jerk the arm. And then that you asked, the grand mal seizure, is one where there's a tremendous amount of disarray of the electrical activity in the brain. That person has what we call tonic and clonic type of motions. They often are on the floor, they can chew their tongue. You have to make sure their tongue is forward. They're shaking violently. And also, of course, during that time, they have no recollection of that seizure. They pass from that seizure to what we call a post-ictal state, where for several hours they're really not themselves, while the brain then reacclimates and resets itself. It's almost like your computer screen just goes haywire, and then you put the reset button on. That's what a grand mal seizure is. Thank you, Patsy, for asking that question. Good question.
Excellent, excellent. Here's a lady called in on our prayer line, 244-1616, or you can go on Facebook. Leave them on Facebook, and I'm checking them on my iPad, folks. Lady called, having pain across her chest and under her breast, but when she sips cold water, it helps. Any idea?
Interesting. So, yeah, she's having pain, but when she drinks cold water, it helps.
When she sips it, yeah.
Yeah, sips it. It's very possible she's having some esophageal spasm, spasm of the esophagus. It's also possible that the sphincter, that lower sphincter we were talking about, it's in spasm as well. And the cool water may just be relaxing that. She needs to talk to her PCP and a gastroenterologist to look down there and see what's going on. That would be a good idea. But it's good that you're able to relieve it with this sips of cool water. But do have it checked. You might need to have a gastroscope just to look down to make sure everything is perfectly okay.
Yes. And real quick, here's a lady has a rare hemoglobin. It will get to 10, not to 12. Can you take a multivitamin? Will it help?
I don't know what that 210, 212 means.
I don't know.
Of that hemoglobin. Let me see.
Hemoglobin.
Her hemoglobin will alter it from 10 to 12. Oh, not to 12. She'll stay around 10. It really depends what is causing it, whether you have Mediterranean anemia and all anemias, by the way, are from either two sources. They're two broad sources, and then there are little things underneath that. Either you're losing blood or you're not making it from the bone marrow. It depends. Most of the time, a good multiple vitamin, regardless of the cause, is not going to hurt the anemia. I think that was your question from what I read here. I think that would be the answer. But certainly, follow it up, find out what type you have, and then perhaps in the future we'll do another show and we can delve into that. That would be great. I think that's what she was asking. 10 to 12.
Great. Got another caller.
We do, and this is Joanne from Greenville. Joanne, welcome to the show. How can we help you?
Dr. Mitchell, my name's Joanne, like you called out. How you doing?
I'm doing great, Joanne. Thank you so much for calling.
Okay. Tell Dennis that I was very privileged to sit beside of his mother, Joanne Thompson. Tell him I used to be a prayer partner out there.
Well, thank you.
And I know something that Dennis don't know. Sister Joanne and I, we were in a car. She was wanting me to ride with her to Greenville, over at Greenville Memorial. Well, she left her, she forgot to take her key out of her car. And so this may be a little embarrassing for Dennis, but it was good in my life. But anyway, when we went in and came back out, Sister Joanne Thompson said, "Oh, Lord Jesus," said, "my keys is in the car." And said, "I don't know how in the world we're going to get in there." And my name is Joanne. And I said, "Sir," he had some clothes. This man was out of town and he had his clothes on hangers. I said, "Sir, could I use one of those hangers for just a second?" He said, "Yes, ma'am." And it so happened I left my window down and I straightened that man's clothes hanger up.
It's happened to us all.
And I raised up that lock on her door. She said, "Well, praise God, so you sure are holy." But anyway, I'm 69 years old. I don't have no heart trouble, no sugar diabetes, no cancer, but I have metal in my left ankle and foot. I broke my ankle in 91, so a few weeks back, I fell in the bathtub, broke my shoulder a few weeks back. But they said when they tested me that my bones were soft and bruising. I drink plenty of water. I'm not nobody for sweets or anything like that. I eat just protein and a lot of vegetables and raw fruit, things like that.
Well, Joanne, you sound like such a sweetheart, and that's a great story you told about his mom, and I think that's great. But we've all done that, you know.
Yeah.
I can't find my keys from 1 minute to the next, let alone one time, so that's pretty easy to do. But if your bones are soft, as the doctors are telling you, there are things that make bone hard, and bone should last a long, long time. And again, you have to go back to when your bones were hard. What were keeping your bones hard, Joanne? They were having the right minerals like magnesium, specifically, some calcium, boron. These are the minerals that kept the bones hard. But simultaneously, we had enough estrogen, progesterone, and testosterone, which actually help the calcium and the minerals get into the bone, stay in the bone, and stay hard. So you have to go back to your PCP and say, look, or to some integrative doctor and find out what hormones can safely be put back in your case, what type of minerals am I missing, and then start doing some weight-bearing exercises and take some vitamin K, which we were talking about a little earlier, which helps the bones get strong, and get yourself on an exercise program that's weight-bearing, like rebounding, you know, a little tiny trampoline if you're able to do that, or even some weightlifting. If you do the combination of those things, your soft bones in your ankle that you've been told will become hard again, just like they were when you were young. You're a doll. God bless you, Joanne. Thank you for calling.
Here's a lady that wants to know what you think about, looks like statin, Staton drugs for cholesterol.
Oh boy, that's a topic that starts me going in that direction.
Most cholesterol, correct me if I'm wrong, I'm not the doctor, can be cured, or not cured, but can be controlled with diet, right?
It can, and exercise. We've overrated cholesterol. And I'll start by telling you a study. I'll end with spirituality, if that's okay. First of all, 75% of the people that have a heart attack have normal cholesterol, as a new study shows, 50 to 75%. So it is a lesser evil than is been made out to be. And the statin drugs, lowering these, in my case, are not as important as stopping cholesterol from oxidizing. We have a membrane around every single one of our 100 to 200 trillion cells. And 50% of that membrane is cholesterol. So God put cholesterol in our cell membrane for a reason. Now, if it's oxidizing, of course, that's an issue, and we need to take the right things, antioxidants and so forth. But if you look carefully at the study that really forced most physicians to write statin drugs is the Framingham study, which, by the way, only showed after 77 plus thousand individuals that cholesterol had a weak, that's W-E-A-K, weak W-E-A-K relationship with heart disease. And the chief investigator, when he left that study, said that people that had the highest cholesterol actually did the best. Now, so I think we're over-treating cholesterol. I think we're over-pushing it. And I think if we eat properly, exercise, and take the proper antioxidants, we can keep it in check. The numbers that we're making up are made up. When I went to medical school, it would be 300 or less, then it became 150, and then it became less than 200. I mean 250, then less than 200. The numbers are just arbitrary, being made up by different people and trying to say it's part of studies, but the studies aren't holding on to the statin drugs and giving us the right information. If you look carefully at the statin drugs and what we call the number needed to treat, which is called NNT, it's a statistic that the companies themselves use. It basically says if a number is less than 30, it's considered having efficacy, meaning give the medication to 30 people, one person gets efficacy, that's good. Like an antibiotic is around 17, a vitamin's 1. So the NNT for statin drugs run 70 to 80 to 90 or more. So you can imagine they're probably being overused more so. But let me end with something that makes more sense than anything, which is a spiritual way of looking at it. Everybody knows that blood sugar has a range. If you go too low in blood sugar or too high, the body is going to do something to try to bring it back to normal. If potassium goes too low or too high, the body is going to do something to try to bring it back to normal. Name any mineral, the body will do something. There's a switch. Isn't it interesting? There is no switch for cholesterol. So I ask you, as I would ask your father or your mother, did God make a mistake? Because there's no switch for cholesterol. There's no number of cholesterol that says at that number, the body's going to do something to bring it back to some range. It does it for sugar. It does it for all the other minerals. Why doesn't the body do it for cholesterol? I don't think any mistake was made.
Right.
I think we're made perfectly. I think everybody watching knows that. And the key is, we're probably over-treating cholesterol. I'm not saying you shouldn't treat it. I'm saying that we should look for what it is, where it is, if it's oxidizing, and then go about it, natural perspective if we can.
Excellent.
That's what we should do.
Excellent. Is there any type of medication that can slow down ALS?
Oh boy, I did a lot of work in ALS. Unfortunately, it's a very tough disorder. We really don't know much about it. We think it's a transport disorder of a particular enzyme that's deranged. Most ALS is non-familiar. It just occurs, and we're not sure why. There's many reasons, and maybe it's a mineral and so forth, but the things to slow it down are fantastic nutrition because it is an oxidative disease. Lots of intravenous nutrition, I believe, at least helps slow it down. Simple things, stay away from fried foods and fatty foods and the sugars. And there was a recent study that even showed that pine nuts, which are delicious, are very expensive, also have been shown to have some efficacy in slowing down ALS as well. Unfortunately, we don't have a full handle on that disorder, but hopefully those things will help, and my heart goes out to you because I did a lot of research in that area. It's a very, very tough disorder.
Okay. Well, we got this might be our last caller tonight because we're less than 10 minutes in the program. Wow. It's hard to believe.
That went fast.
I know. You got to come back soon.
That was really fast. I hope so.
Well, we got Diane from Greenville. That's my mother-in-law's name.
Wow.
Diane.
Diane, hi.
Yes, how are you?
I'm doing great.
I have been diabetic, gestational diabetes that turned into regular diabetes 25 years ago.
Okay.
I've been on insulin most of the time, and the doctor gives me so much medicine for the pain in my legs, and it doesn't seem to do any good. I'm getting to where I can hardly walk now. Do you recommend anything for the pain that he says is neuropathy? Everything else has been checked out, and it's mostly neuropathy in my legs.
Well, Diane, that's a great question. First of all, the first thing you said was that you're on a lot of insulin. You have to determine whether really you are a type 1 diabetic or a type 2. If you're truly still a type 2 diabetic and not a type 1, then the insulin may be hastening your problem. and may be causing more inflammation and creating more damage to these nerves. You need to find that out, because type 2 diabetics have plenty of insulin. The receptors don't recognize it. So if you're still type 2, get to someone who really understands this disease to try to start getting you or weaning you off the insulin. In addition, try to get, no matter what you're doing, your sugar to be as normal as possible. Just so you know, sugars less than 100 are good, but at 85 is considered optimal. Anything even over 85 is already considered a problem. So get it below 100 if it's possible with your physician's help. And then you need to do some things for the neuropathy. Check out with the physician alpha lipoic acid. 1,000 milligrams a day often helps this type of neuropathy, along with the methylcobalamin, the B12, the Cadillac called methylcobalamin. You can find it. If you want to look at it, read about it, go to the drmitchshow.com site, drmitchshow.com site, and you'll be able to see it. And sometimes doses of 20 to even 40 milligrams a day, very high doses of this B12 are needed. And don't look for results very quick. You need to look for results over an 8-week period, but you've got to bring that sugar under control, because on one hand you're trying to help, on the other you're creating even more damage to that sugar and hence to the nerve. Find out what kind of diabetic you are. Really constrict your diet. Try to go all raw vegetables right now, at least for 6 to 8 weeks, and I think that will be really helpful. Thank you so much for calling. I know this is a tough problem. We've talked to several people, called about it, this neuropathy. It is terrible. It's a painful
diabetes
disease.
goes hand in hand. Right?
It does, and we're at right now, if you look at just people in the pre-diabetic category, I don't even really understand what that means. Basically, it's still going to increase your risk of cardiovascular disease and everything else. You're talking over 60 million Americans alone. Yeah. It is a disease. And here I think is the key, which I think it will bring the show towards its culmination. I know we're almost out of time. And that is, these disorders are self-inflicted. Many disorders are self-inflicted. And we bring that back because we have to be responsible for ourselves. I always think of the story about how you have to be responsible for yourself. When people look for a miracle, you know, it's like the guy is drowning and he says, God, I've been the greatest. I've gone to church all the time. I pray every day. And a boat comes by and he says, no, God will save me. And you know how the story goes. After 3 or 4 boatloads, he drowns. And when he's greeted by St. Peter, basically, what is it? I was a great person. Why did I not get a miracle? He said, you did. A boat came by, but you have to reach your hand out. You have to take responsibility and get on that boat. And folks, if there's anything I could leave you with tonight is become responsible for your health. Start slow. Try 1 thing, 2 things. Write me at drmitch@drmitchshow.com. I'll be glad to answer your questions. And if Danté, boss here, says, we'll be back and we'll do this more.
Oh,
and
you
we're
got
help you.
to, because we probably got 20 or 25 questions here unanswered.
Wow. Well, let's save them. We'll save them for the next time.
Yeah, we'll save them. So, yeah, this has been a fascinating show. I always learn, you know, like I said, when I host, I always learn something. And I have truly gained a lot of knowledge tonight. And I know for myself, I think I need a physical.
Yes.
And one thing I was wondering just a second ago, you keep talking about raw vegetables versus cooked vegetables. Like steamed broccoli versus raw broccoli. What does the steaming process or cooking process actually do to the vegetable?
Well, you know, the raw foodists would say that if you cook, you kill the enzymes. Although certain foods are best by cooking, regardless of whether you're eating raw or cooked, like a broccoli, if it's organic. One of the mechanisms that they did see that does release those good type of sulforaphans, which help our body fight many of the cancers, especially prostate and breast, is the chewing mechanism. We have to chew because that's what releases, like garlic. Wonderful food. You have to chew, because that's what releases it. We're always so much in a hurry to eat our foods. So whatever foods we take the time, folks, chew them up well, and then swallow them, because that will release a lot of the good material.
Excellent. And vitamin K you mentioned tonight. What greens are popular for having vitamin K in it?
Kale and collard greens. We have plenty of that in South Carolina. All those greens, and especially like the types of things like parsley and all the other types. They're just great for that type of thing.
Excellent, excellent.
Great.
We just got 2 minutes left. Would you want to leave with our audience tonight?
Thank you for asking. I think what we want to do is start to make a decision, finally, and the decision is to change your life. For like that woman that called and said, I need to make a decision to do something. I'm tired of it. I can't do it anymore. Make that decision. Look in the mirror and say, tomorrow morning, I just want to change one thing. If you don't like what you see, just begin simple changes in the diet, simple changes in exercise. Don't go harsh. Don't go crazy. Just get to one thing. And remember that God's with you all this time, and God wants us to be healthy. So I leave you with, be healthy, and God bless. And thank you so much for having me tonight.
Thank you. And it's never too late, Dr. Ghen.
It is not.
No matter how old you are, how young you are, how big you are.
That's right.
I'm going to work on it. Next time you see me, I'm going to look like Hollywood up here, right?
I got it. I'm waiting.
Well, we are out of time. A lot of callers that unanswered questions. Email you. You answer all your emails.
Absolutely.
Dr. Mitch at drmitchshow.com. Is that right?
That's correct.
There's the email. For more, if you missed that, don't have a pen ready, you can call the station tomorrow. We can give you all the information. You've got to come back soon.
I'm coming back soon. If I'm invited, I can't wait. I feel home again. I love it.
Sounds
I'm back.
good. We're out of time. Thank you so much.
Pleasure.
Hey, be sure to tune in tomorrow night for more Nightline. And until then, go with God, and He will go with you.